February 15, 2009, Carolyn, a single mother of two, goes to the hospital with heavy bleeding and excruciating pain in her back.
It felt like someone was taking a hot poker from a fireplace and sticking it in your back.
Tests came back positive.
She's pregnant and in active labor. Carolyn begs for an epidural just as the doctor arrives.
Where we going, Caroline?
Need something for the pain.
All right, let's see. It's too late for an epidural.
He goes, oh no, you need to push. I'm like, this isn't happening. I've only known about this for an hour.
You can do this.
The birth labor, there's no way to explain the pain.
The gush of blood Carolyn experienced at home was most likely her water breaking. She is now fully dilated and ready to give birth.
Even though I was pushing, I didn't want to believe it or realize it either.
Look at me, take a nice deep breath, and now give me a big push.
Minutes later, Carolyn vaginally delivers a baby boy.
Beautiful boy.
I was shocked.
Then her worries only intensify.
And after I had him, he cried like a little cat. It was like a cat's meow. He didn't really have a cry.
The doctor cuts the umbilical cord and hurries the newborn away.
Carolyn?
I was very scared. I asked,
Is he okay? Where are they taking you?
I think he might have a little fluid in his lungs, but we're going to do our best.
And that sent panic in me even more.
Carolyn's own medical ordeal is far from over, though.
At the time of the birth, I was hemorrhaging.
You're bleeding a little bit more than usual, so nurse, could you give me 2 units of O-negative blood? Just that.
They told me that I was anemic and that I was going to need blood transfusions.
Carolyn undergoes an emergency blood transfusion. Her anemia has caused a dangerous loss of blood, which, if not treated properly, could lead to an increased risk of infection after birth, or her going into shock. Even still, she can't stop worrying about her new son.
Not being able to get up to walk to the nursery to see what was wrong with him, I was hoping everything's okay.
Fortunately, the blood transfusion prevents any further complications, although she'll have to continue to carefully monitor her iron levels.
Goodness, he is doing just fine.
Carolyn is reunited with her 6-pound, 10-ounce baby boy, who she names Nicholas James.
That's when I felt the most relief, being able to see him and hold him.
Premature at an estimated 33 weeks, the newborn's lungs are slightly underdeveloped.
Other than the baby breathing a little harder, the doctor says he's healthy.
Carolyn is finally able to share the good news.
Jolene, you're not going to believe this. I got a call saying, I just had a kid. And I was like, what?
Miracle baby.
So how is it that a mother of two didn't realize she was carrying a third child?
I didn't show anything. I basically had symptoms that I thought were medical. Because with my other 2 kids, I stopped my time of the month when I was 4 and 5 months pregnant, so I didn't think that I was pregnant.
Carolyn most likely conceived in July of 2008 after failing to use birth control.
The only explanation I have is we use no protection.
Her irregular menstrual cycle then seemed to continue normally from July through January.
I didn't miss any periods. I never put it together I was pregnant.
There are several causes of spotting during pregnancy. Possible bleeding of implantation when the egg gets fertilized and is implanted into the uterus. You can also have bleeding from the placenta, bleeding from the cervix, and other complications.
Strangely, in spite of her cravings for chocolate, she didn't gain weight during the pregnancy.
This can occur because every pregnancy is different, and there are varying amounts of weight gains with each pregnancy.
Looking back, I would say I had some symptoms: tiredness, fatigue, no energy. I just thought it was my anemia.
Anemia in pregnancy is dangerous. A woman can become severely anemic, and at the end of her pregnancy, when it's time to deliver, she could possibly hemorrhage and require a blood transfusion and could possibly die. Anemia symptoms could easily be confused with pregnancy symptoms. Fatigue and lack of energy are common to both.